What is an allergy? An allergy indicates a condition with which a subject's immune system reacts abnormally to produce antibodies against certain substances, considered harmful, which for most people are harmless. The tissues and organs involved in allergic reactions are the lower airways, the skin, the nasal mucous membranes, the eyes. The symptoms are due to the release by the body of chemical mediators, e.g. histamine, in response to the immune reaction triggered by the meeting of the allergens with the antibodies. Exposure to the allergen. Exposure to the allergen that lasts for months or years sensitizes the immune system, and subsequent exposure to it or to a related allergen causes an overreaction. Normally the immune system protects the subject affected by infections and diseases, but with allergies, the immune response can be harmful to the body. Allergies can be thought of as a normal immune response not necessary for a benign foreign substance. The immune reactions involved in allergies are quite complex. Most reactions involve allergic protein molecules combined with antibodies in the blood. So they attach themselves to a type of cell called a mast cell. Mast cells are found in many tissues throughout the body. When the antigen and antibody react with mast cells release powerful chemicals, such as histamines, that cause local inflammation such as redness, swelling, and itching. This inflammation causes various signs associated with an allergic reaction. Even in domestic animals, allergies are quite frequent phenomena. These, in fact, affect both dogs and cats. They are very studied pathologies but still not completely understood in their way of acting at the level of the whole organism. What are the symptoms of allergies in dogs? In dogs, the most common symptom associated with allergies is the itching of the skin, localized in an area or generalized all over the body. Sometimes there are areas of very marked redness and inflammation. In some cases, the symptoms involve the respiratory system, with coughing, sneezing and/or wheezing. The presence of phlegm or persistent nasal discharge is not rare. Sometimes, there may be blood loss from the eyes or nose. In other cases, allergic symptoms affect the digestive system, resulting in vomiting and diarrhea. What are the symptoms of allergies in cats? When a cat has allergies, its immune system is overly sensitive to certain very frequent substances and begins to identify them as dangerous. Although these substances, or allergens, are usually common in most environments and harmless to most animals, a cat with allergies will have an extreme reaction to them and will start to experience a series of specific symptoms. These symptoms occur because the body tries to eliminate the causes. General symptoms of allergies in cats: sneezing, coughing, if the cat has asthma, wheezing or forced breathing. Itching of the skin that can be localized or generalized. Itching with eyes that run off an opaque and greenish exudates. Itching in the back or at the base of the tail, the most commonly seen in allergies caused by fleas. Itching in the ears, both on the outside and inside. Vomiting, which can be frequent or rare. Diarrhea. Snoring caused by an inflamed throat. Swollen paws. How common are allergies in pets? Unfortunately, allergies are quite common in dogs and cats of all breeds. Most allergies appear after the animal has turned 6 months old, with most animals showing signs of allergy within 2 years of age. However, there is no fixed rule. Some allergies occur even in old age. A question frequently asked the vet is the following: are allergies hereditary? Some allergies are thought to be hereditary. A hereditary allergy is an atopy or pollen and plant allergies. Other allergies such as food seem to be specific to each subject and not related to a family history of allergy. We try to understand which substances can be considered allergens. In reality, a very large number of substances can act as allergens. Most are animal or vegetable proteins, but small chemical molecules can cause allergies. Examples of common allergens are pollens, mold spores, dust mites, skin flaking cells similar to pet allergies in humans. Protein derived from insects such as flea saliva and some drugs. Therefore, it is clear that it is extremely difficult to categorize allergenic substances. In reality, the types of allergies that affect dogs and cats are many. 1. Flea or insect allergies. 2. Food allergies. 3. Respiratory allergies. 4. Contact allergies. 5. Drug allergies. 6. Photoallergy. 7. Atopy. Atopias deserve a special mention because they are particularly complex allergies. When we talk about inhalation allergy, we refer to atopy with this term. We mainly identify inhalation allergies. The main causes of inhalant allergies are, for example, tree pollens, cedar, ash, oak, etc. Grass pollen, ambrosia, molds, fungi, and house dust mites. Many of these allergies occur seasonally, such as ragweed, cedar and grass pollen. However, others such as mold, fungus, and house dust mites occur throughout the year. Therefore it is difficult to establish the causes in relation to the period of the year in which they occur. Atopy is a very common pathology in both dogs and cats. A disease that is difficult to treat but can be controlled. Atopias usually occur in dogs between 1 and 3 years of age and in cats between the ages of 8 months and 2 years. However, atopias are much more frequent in dogs than in cats. It has been noted that atopic dogs often develop important food allergies. Flea allergies seem to be a further trigger, but this aspect is still not clear. Contact allergy. Contact allergy is the least common type of allergy in pets. It affects the dog more than the cat, but in the latter, when it occurs it can have more serious consequences. It derives from the direct contact of the animal with allergens, such as the pyrethrins present in collars against fleas, pesticides used on grass, herbs, materials such as wool or synthetic materials used in carpets or blankets, etc. Contact allergies can develop at almost any age and can occur suddenly without any previous symptoms. Skin irritation and itching will occur at the contact points, generalized throughout the body. The lesions will be circumscribed and marked with skin that can emit transidate. If the dog is allergic to one of these substances, skin irritation and itching will occur at the contact points, usually the feet and the ventral part of the stomach. Removing the allergen, once identified, often solves the problem. Sun allergy or photoallergy. Sun allergy or photoallergy is a reaction of the immune system to sunlight. This disorder occurs most often with rashes and itching. There are different types of sun allergies. The most common form is solar polymorphic dermatitis, which affects the dog more than the cat. Classical allergy therapy. The appropriate pharmacological treatment depends largely on the duration of the specific allergic season. It may involve one or more of the following drug therapies. Anti-inflammatory therapy. Treatment with anti-inflammatory drugs such as corticosteroids or with antihistamines rapidly blocks the allergic reaction in most cases. In some cases, the integration of fatty acids into the diet can improve the response to steroids and antihistamines. Recently approved drugs such as oral cyclosporin are also very useful in treated atopy and have fewer long-term side effects than corticosteroids. However, these drugs, although capable of quickly blocking the allergic phenomenon, are responsible for serious liver and kidney damage, so their use cannot be prolonged over time. For the resolution of allergic phenomena, it is advisable to evaluate very well the diet to which the animal is subjected. In fact, industrial diets often contain products such as stabilizers or preservatives which, as mentioned before, can develop allergic phenomena. It must be remembered, in fact, that food allergy generally does not respond well to corticosteroids or other medical treatments. The treatment requires the identification of the components that trigger the allergy present in the diet and their elimination. The most accurate way to test allergens is with a dietary elimination test using, that is, a hypoallergenic diet. This diet will take between 6 and 8 weeks, during which all the different types of food will be eliminated one by one. Some individuals may show strong allergies even towards homemade food diets. Natural therapy. Today, natural therapy has made great strides in the treatment of different forms of allergy. Both normal allergies and possible atopias can be treated successfully using naturally based products. These products, in addition to acting quickly, will be able to reduce or eliminate allergy problems altogether. Their composition allows prolonged use over time without incurring physiological damage. It is important to follow an appropriate natural protocol to achieve satisfactory and lasting results.